not everybody peels when they get a chemical peel. You don't always want to peel. That what is the goal?
Yeah.
Setting the expectation for this is your skin tone and these are the limitations because of the possible complications. Welcome to this week's episode of Beauty Babble. Today we're talking about chemical peels. More specifically, we are exploring if chemical peels are safe for clients with darker skin tones. We did some pre-chatting. We're both very passionate about this, I would say. How are you doing today, Suzanne?
I'm doing well. Well, you know what I think too is that we've been in this for a long time, so it's changed over the years, and we have to understand what the updates and what's been happening. It's just staying on top of things. So I'm glad that we had a chance to kind of
Mhm.
pre-chat a little more about it. It has been something that people have asked questions about because everybody feels like they qualify for appeal.
Yeah.
And from today's world, it's like age 10 to and up. Like it's just everybody. It's and with all of the types of trainings out there, I think we're just trying to bring on some, information so that you can think about what you're doing when you are planning your treatments in the treatment room.
I think accurate. And then your clients are going to come to you with questions because they're watching social media and they're watching people doing peels on themselves and peeling. And it really, on social media, I've seen people with all the Fitzpatricks doing chemical peels. And so it gives me pause to think like somebody's going to watch it and think, oh, I can go ahead and do it. But they're like a Fitzpatrick 6 or 5, and that would always be, let's stop first. So so when we are talking about our darker skin tones, we're referencing like the higher Fitzpatrick. I think you even said maybe 4s, 5s, 6s. Sometimes some of those cautions will go into the Fitzpatrick 1 as well, right? So you
Mhm.
just have to be aware of the skin that you're working with.
And on that note, what do we always start with? The consultation,
Consultation.
which people, I think too sometimes what happens is we're so comfortable with it and we just carry on through it. And I think we need to just pause. As we know, not always do we have all the information from our clients, even if they fill out the forms ahead of time, you've had a chat with them maybe via phone or text or messaging. But in a consultation, when you start talking to that potential client, I think you find out a lot more when you start having conversations because then you can add on that, well, tell me more about that,
Mhm.
or all these things. Like I still remember a time this one client, we thought we had everything covered. She comes in, and I just happened to say, oh, what are your plans coming up through the winter? Because at Edmonton, Alberta, October, usually people are planning their Christmas break. And I did know this client somewhat of her background. She was a teacher, so I knew her time off would be Christmas break with the kiddos, right? And she said, oh, we're going to Hawaii for 2 weeks. And I was like, red flag, red flag.
Yes.
Never did she mention it. And it's something like, even though I said, do you have any vacation plans in the near future? To her, that wasn't the near future,
That's a good point. Yeah,
right?
because what
So
is the near future?
it
Yeah.
define that, right? And I think that's why, we have these, devil's advocate, I guess, is what we
Mhm.
really are on this podcast. Hey,
Yeah.
yeah, but
And I think
in them.
and that is goes hand in hand with like I would ask them about their daily routine. Like what do you do for your skin on a daily basis? I wouldn't prompt like, I want to
Mhm.
know, are they cleansing? Are they moisturizing? Most importantly, are you using sunscreen? Do you stay out of the sun? I'm not going to prompt. I want to just see where they come up with when they talk about their daily routine. And I think you can also tell like clients who if you do other body treatments on them or waxing, you can tell if they're a little darker in the face or when you're doing a, Brazilian wax on them or whatever, you know what I'm saying? So
Right.
just really knowing like what is your daily routine because somebody who doesn't incorporate sunscreen into their daily routine might not be the best candidate for a peel regardless of your Fitzpatrick, but
Mhm.
especially a darker Fitzpatrick.
Definitely. Yes. The other thing too is the medical history. We need to keep in mind to, even if you know your client, you should be asking these, even in general conversation, especially if you do know them. Anything else? I know this is a new treatment, so I'm going to go through this one more time with you, even though you've had waxing and facials or whatever it else may be. What else is there that we aren't thinking about? Like, so you're doing, I don't know, manicures or nails on this client, and they decide on a peel treatment with you. Do they keloid? Do they, like, there's other things to think about, any kind of sun damage that they've noticed. Sometimes season, you don't see their pigmentation
Mm,
until they go into the sun. That could be hypo or hyperpigmentation, right? So those are things that people just remember. I would just say throw caution to the wind and redo that form, even verbally with them. You don't have to hand it to them, but go through your medical process of just touching base with them again. And
yeah.
have they been on medication at all? Like, you just don't know, even with antibiotic, photosensitive ones, right? That's going to affect, have a, what's the word? Potential risk with it, doing those types of treatments.
Yeah, I
I
like
think
the way you worded
one,
that.
sorry, yeah, the other thing is too is like, what's their goal and expectations? I've had people say, well, Suzanne, I had a peel done and I didn't peel. It's like, well, what do you mean you didn't peel? Well, I didn't peel like a snake. I didn't see the skin come off, so it didn't work. Okay, you used a regular a skincare routine. You're exfoliating once to two, three times a week. You get facials every 2 months, or
Mhm,
you're doing things already. What did you want to come off your face? This dead skin is only going to be there if it's there. You can't
mhm.
create dead skin on its own, right? Without, like, you know what I'm trying to say.
Yeah, and I think the name is deceiving though too, because chemical peel, that doesn't mean you're going to peel. Not everybody peels when they get a chemical peel. And it really depends on the intensity of the peel that you're doing. You don't always want to peel. You know what I'm saying? That what is the goal? And I think that's a really good place to start because if is your client like, is this person booking with you to come in for a chemical peel out of nowhere? Because it happens. Like people, they see it's an available treatment, somebody will book for it. Like this becomes a consultation appointment before we even book the peel
Yeah.
because it's you have to prepare. You have to prepare your skin to get a peel. And you can't just like come off the street, come see your esthetician and go walk right in and get a chemical peel. Maybe some places do that, but you should not do that. You really need to it's a long-term relationship with your client and their skin.
And we are talking about the aesthetic side of things. What the medical world does, that's different. That's not in our scope of practice. So we're keeping it to our level of training.
Mhm,
And so really what you're saying is like, hey, consultation, you want to know skin assessment, medical history, what are their goals and expectations? Are they realistic? And
mhm.
in that, I think it's fair to say you should be choosing and telling them what's the right peel you recommend to them, and then talk to them about the pre-treatment peels before you even start. So when they finish that
Absolutely.
consultation, they're going home with their pre-treatment peel kits.
And a plan. Like when I used to do
Mhm.
clients full time and do peels, nobody came for one peel. It was a treatment series where we would go through the next few months, how we would space them out, what you're going to do in between each. And that's where it becomes really important to talk about that future. Whereas, like, I'm like, we're doing this in January, or we're doing this in February. Like, you need to be sun avoidant in all of these times. Maybe that doesn't work for the client. So let's reanalyze our plan. It is it becomes a bigger plan because I feel when we talk about peels, we're referencing the goal. Why are you doing this? And how do you achieve your goal? It's not going to be one peel.
Right.
Yeah.
And like, you do have people who ask, like, you touched on that social media side, that people are seeing this, and professionals are seeing it, and
Mhm.
they want in on the trend. So just question yourself. First off, we always say this: check your products of what you have already. Do you really need to go and buy another product? Is there something that you could have in your back bar already in your professional skincare? And if you don't, ask your educator or provider, what
Mhm.
do you have that's similar to this? How can I customize this? because you can't keep up with the trend. That's like saying you're going to go buy the new iPhone every time it's out, right? Like, like there's always some pluses and minuses to it, but sometimes, people are like having a hard time surviving financially in this world. And
Mhm.
sometimes because we're also not, owning up to the fact that we're jumping on social media like our potential clients or clients, and you're jumping in like them too. And you just, oh, what's that? What's this? And you're just chasing that. And
Yeah.
you're not becoming a specialist, that you're not really refining your skills
Mhm.
that you have already. And I think that's educating your client to what you do. Then they won't be looking at those things. And if they do, more than likely they're going to ask you, hey, Jareen, I saw this on social media. Do you have this? What is this?
Yeah,
Be
what are your thoughts?
ready. Yes. And if that's what your clients are doing, that's where you want to be
Mhm.
because they're trusting your opinion. So good for you if that's what's been going on. Maybe not everyone does it. You can't train everyone. But if a lot of your clients are doing that, that's, kudos to you. You're doing a great job.
Yeah. But and
Oh,
talking about like when you're choosing the right peel, I think it depends on what are you able to do within your scope of practice, because it depends on how you were trained, right? Like,
yes.
were chemical peels included in your aesthetics training, or was that something that you had to get on top of it? And did you have to do just one or two? Like, there's different levels of training that comes with doing the peels.
Mhm.
And with each level, I think that it's different intensities and depth of
Mhm.
peel that you can do.
It's interesting
Again,
'cause
within limitations of aesthetics. We're not going too
yes,
deep like the medical.
yeah, I know there's some people who have asked, they're saying, okay, we did do this in school, and this, well, how many treatments did you do? Oh, we just saw a demonstration. So you never did one on anybody? No. I said, how do you feel about that? I feel terrible. I can't do it. I don't feel confident enough. Yes. So when you're out there searching for the programs, find out what it is that how do you get your hands on side of things so that you feel more confident, because you should be scared of peels. I think it's healthy to
Yeah.
be, scared, but you know what I'm saying. You're a healthy
Cautious.
awareness to it,
Cautious.
right? And
I think, yeah,
mhm,
because I think that's really good. And I think you saying that about specializing, like, if this is an area that you are really interested in, then you need to go take more courses, go become a specialist and know everything there is to know about peels. You can take advanced courses and get really focused on this area. But yeah, I would be hesitant. Like, you don't want to, because it can go wrong. I think we're going to talk about, the possible complications as they come up. But, i- in before we get there, we can just choosing the right peel depends on your training and it
yeah.
depends on your client's goals, right? So
And
that's how
can you do a treatment plan for them and tell them this is what we're going to do this week, next week, so on at home? Like, you need to give them a plan. It's
absolutely.
like a personal trainer in peels, right? Like, and I think we have to own it to that level. And if you're not confident about it, if the product line offers a training, then get it.
Mhm.
No,
And the
see, taking it
and
this.
yeah. And the first step is, in your plan is your pre-peel. So before you even get a treatment, your client needs to go home with products and they need to prep their skin to with exfoliation and whatever I mean, I think it depends on the line,
The
right?
goal. On the line
And
and the goal, I think too,
yeah,
right? A little bit, yeah. And it's
yeah,
it's really conditioning the skin so you don't get that post uh, inflammatory reaction to
right.
the
Your
skin.
reactions, yeah.
That's the whole point of just going slowly. Like, think about, you never worked out, and you're gonna go out and you're gonna do a 5K run. Like, how are you gonna feel the next week?
Right.
Terrible. Your reaction is gonna be awful. Your inflammatory system is gonna be off the charts. Well, your skin is the same thing. Our whole body works in that capacity.
Mhm.
The other thing is the sun, like you said. I think it's a big one. Be confident to say no to your clients or postpone. Say no for now. But listen, when you come back in January,
Mhm.
whatever that date is, let's look at that, because you're not traveling again till when? So, no, I won't be traveling from there. Oh, I'm actually going to be golfing. Okay, golfing season in your area starts when? So
Mhm.
you're looking at the window of peel season for your client. We have a peel season, but not always does it work that way, right? It could be what climate, it could be your area, the time of the season, but it also could be your client themselves.
Yeah.
What about the lifestyle, right? And I think you have to remember all those things. And if you explain to your client why, they're going to respect you to give them, all the information they need so they can make the right decisions. It's not just no, I'm not doing it.
Yeah.
Give them the why behind it,
Yeah.
right?
And alternative, like you said, you can postpone
Yeah.
it or you can find an alternative treatment. Maybe
Mhm.
just do regular facials or I don't
Right.
know, something that will just in the meantime till they can help them prep their skin for that treatment.
With you, what Fitzpatrick would you say you are during? Where do you fall, do you think?
I believe a 4.
A 4. Have you had any reactions to peels? Your skin always handled them pretty good, right?
Yes.
Yeah. Yes. Okay. I mean, I'm lighter than you, so that's why I wanted to ask, and you're a 4, so that's good.
And I do think you're right, like, I darken very easily, but I also, like, do not have reactive skin at all, and I
A
was
good
cautious.
point.
I was
Yeah.
cautious when I did my peels, right? I pre-peeled, I stayed out of the sun, I didn't wanna cause any damage, but it really depends, and I think patch testing is a good idea to do to see how your client is going to react to a
Mhm,
peel if you don't know their skin or they're
mhm.
unsure about it. Maybe they've done peels before and they haven't had any issues.
You could do it even in the consultation, could you not? And then even beforehand how things are going. Why wait for that first treatment?
Yeah.
Why not see where they're at and how they react? And if you keep it as a protocol and standard, you're not picking apart any certain Fitzpatrick. It's just protocol. We do it to everybody. I think is a really great practice
Yeah.
to do for that first time person, right? Or maybe it's a new peel. You're trying something different. You've come across something new you were trained on. So anytime like that would be a patch test,
Yeah.
right? Yeah.
It's a good idea. It also allows your client to, get a little sampling of
Yeah.
what it could feel like. I mean, different parts of the face will react differently. I think it just
Mhm.
depends, right? But it's just a good way to ensure that you're on the right path with what you've chosen for your client.
Okay, what about during treatment? Let's talk about the treatment itself. What are some key things that we can help our listeners with when we're thinking about it? Is the time of the treatment.
Okay,
So,
so well, I think when it comes to the treatment itself, it depends on, the kind of peel that you're working with. My biggest thing is like, and I would do this during the consultation, but just really making your client aware of what to expect during the treatment, what it's going to feel like. And there usually you ask for a rating, like if from 1 to 5, and 5 being really terrible, how like really explaining like what that feels. I
mm,
had a different type of treatment, a massage treatment, and she was asking me to rate it, but she didn't really explain like the limit of 10. I'm like, "Oh, a 12." And she's like, "Well, that's hospital." I'm like, "Oh no, then I'm
oh,
being dramatic. It's not that." So really explaining what does 5 feel like? What does 10 feel like?
mm,
Just that you're getting an accurate read on your client's reaction. Because sometimes you're watching, like, you read the peel, like, you have to watch and see what's happening with the skin, but you also need to ask your client to tell you what it's feeling like for them.
yeah. So, like things like, of course, you would think, especially if it's a stronger peel or deeper, I should say, a deeper peel, excessive redness. The term frosting comes up. What is that exactly? So people understand. Irritation is another. We know that's a big, flag, but frosting can happen during peels, the deeper peels, the
Frosting
advanced
can
peels.
happen, but if we're talking about a higher Fitzpatrick, your first peel on them should not be any peel that would result in frosting to begin with, and
Mhm,
not one that I would even want to attempt on somebody with a higher Fitzpatrick. So I think when we're talking about choosing the right peel, because in this episode we're really focusing on our darker Fitzpatrick,
mm,
you're looking at the percentage of your peel and you're looking at the pH, because that will determine how deep it goes into the skin and the type of peel it is, right? Like, is it glycolic? Is it lactic? Because those different molecules penetrate at
differently. Mhm,
differently into the skin, right?
right. And
Um,
some of them have a combination, right?
and some of them are combination. So just really understanding what am I doing and how does it penetrate? With our darker Fitzpatrick and me being like super cautious, I would literally pick the lightest peel I had for the first treatment because the saying, I think this comes from somebody else, not me, but slow and steady wins the post peel race, because really the goal of the treatment is to get to the goal of the client, and that is to make sure you don't have any post peeling complications. You want healthy skin and no reactions after their peel.
Right. And I think, touching on that is just understanding, the guidelines of the peel that you're using.
Yeah.
And like you said, that that step by step building on the peel, not in the treatment, but as each treatment goes on, whether it's 1 week
Yeah.
apart, 2 or 3, right?
Well,
Mhm.
within each treatment too, like you can intensify your peel
Right.
depending
As you go
layer.
layer.
Some peels are layers, some peels are time peels. So with
Mhm.
each one, you would then determine, because sometimes if the first treatment is your lightest peel, like maybe you do the lightest peel and you only do one round, whether it's one layer or one timed uh, round. And then the second treatment, you stay with the same level of peel, but you just increase the time or you increase the layer depending on the type of peel. You can increase it that way. So we don't have to increase the intensity of the peel that we're doing, but we can increase our timing and our layers. And
Right.
that will also help you advance in your peel from treatment to treatment without pushing it too far and
Mhm.
causing any complications for your clients.
Right. Right. Nice point. I like that.
This is making me want to go get a peel.
I know. And it's almost time.
Yeah.
Okay, and now I think we've touched pretty good on the treatments itself. Again, if
Yep.
you've got questions, we really do encourage you to your educator of the product line that you're using. They should be able to help you and discuss, and just even like sometimes people haven't done a peel in months because of the season, right? That's fair. So now, okay, it's coming. It's our peel season. I know we say that a lot in our industry, but if that's the case and it is your peel season time, then okay, go back into your notebook or online, your PDFs, whatever you've got, and start revisiting that and relearning, and make sure you got all your, T's crossed and your I's dotted, as they say. So
Yeah.
now post treatment. So post treatment is always fun because people forget about post treatment sometimes. Our clients like to forget sometimes. I'm done, so off I go.
And this is actually, we talked about this in our insurance episode. We talk about this all the time. Take some pictures, people. Take pictures of your client before, take pictures of your clients after, to document the redness or if there's reaction on the skin, right? And then I would always print out the instructions. If you have like a digital process, print them out anyways and send them digitally and remind them repeatedly, because it is crazy how little people read. And then in the moment of after you're peeling, you panic and you're like, well, what was I supposed to do again? And if they have a place that they can reference for that, the more places that they can go to really get that answer before they decide to do something is the better.
Now and you'll be so proud of me on this one. With technology, you can even have your stuff set up as automations that go out after your treatment. So if it's
Absolutely.
a booking, maybe your system does automation so that that post peel care reminder it gets sent out to them, or maybe it's part of your protocol that, okay, write it down. Like, did I send out, you know, a note, an email, a text, a DM, whatever you've got to do. I'm all about time, so I'd rather have mine set up. But
Mhm.
if you're a person that's got to go in there and manually do it, then you got to have the time to do that. Make sure that you cover that. So, post treatment care, like I'm talking, they're done all of their sessions, right? But there's also post treatment care during the treatment process of
Yeah,
however many
after
treatments
each
you're doing
peel. Yeah,
after each peel, right? So again, I would
product.
imagine,
You gotta send
yeah.
them home with product. You cannot send them home to use their own product. I
I
would include it
key.
in the pricing of the peel. It's
Mhm.
included, it is mandatory that you take this, and then this is what you use, because that also helps your client not get confused over, should I be using this? You can number it, you can label it, whatever, but just having like use this, this, and this, Usually, like, the first 3 days it would be different. And then, so just really having a clear instruction list for how to use the products for the first, few days after the peel until. Because if they're doing a series, right, like you're going to post peel and then you're going to go back into your pre-peel treatment protocol. So you'll
Right.
always be in the
In a
in the system, in
Yeah.
the cycle of your peeling, right?
And that sounds like sales. So I'm gonna touch on that. You are not selling them the product, you are selling them a treatment. And
It's
it has a
included.
protocol, and it's a protocol. So if your clients love their products at home, ask them, can you stop using it just for this time? And when we're finished, I will help you get back into your old product. But for the safety of this, I don't know your products that you're using. I know what will work here. And it's
Yeah.
just part of it. You have to say it with confidence because clients, if you're not confident, well, I don't know, like I don't really recommend it. It's like, are you sounding confident? No,
No.
it's you got it. That's part of your verbiage. You're going to have to be confident and explain
Yeah.
to them why. You're not selling them. You're giving them a treatment and you're setting them up for their goals to be successful. And if you don't bring that all together,
Yeah.
that I think that it comes with time and I get that. But if you've been at this for a while, you have to have that level of confidence to tell your clients the truth of all of it. Your doctors
Absolutely.
do. Your
And
doctors do.
this is in the consultation. Like
Yeah.
in the consultation with your treatment plan, these are the products that are included in this treatment. These are the only products you can use for
Yes,
because, and you explain why, right? This because
exactly.
we're reaching a
They're
goal.
made together. There's a
Yeah.
purpose behind it all. I'm not honestly not trying to sell you a
No.
product. I'm here to
And I think
sell you.
clients are okay with that though.
It's how you direct it and say it, right?
Yeah.
And I think
Yeah.
a big one too is, make sure the clients understand that they're following your protocol. So no outside exfoliations. Don't get other treatments done. Do you promise not to do dermaplaning? Do you
Yeah.
because they're jumping all over ship, all over the
Yeah.
place, getting treatments done.
Yeah.
So I think just help them understand of what to avoid during these next few weeks, months, however long your treatment plan, that consultation, give them the whole thing. I've spent an hour in a
Mhm.
consultation with clients and I can't consider it even to be super advanced peels that we did, you know,
Yeah.
30% glycolic, some salicylic, but still, I mean, there's other things there. What else? Oh,
I think
follow up is a big one,
just
right?
one more thing about the
Mhm.
post treatment. I would also just explain what to expect because I think at like day 7, your skin is going to look horrible. You are going to hate it. It's going to be like
In what
really, it just like it's going to be gray. It's just not, you're going to want to feel like you need to exfoliate your skin or something. So I think just having that
potential?
expectation, like just saying,
Mhm.
okay, for the first 3 days, it might be red, it might be itchy, whatever. But after that, then it's gonna by day 7, and this depends on the peel, right? You need to know the product that you're working with. But by this day, it's going to look very dull. It's going to look really drab. Don't do like then just keep going by day 10 or whatever it is. It's going to look a lot better. So just really setting those expectations
Mhm,
and
mhm.
just laying it all out because I know even though I knew it, when I would do it on myself, I hated my skin at that point, and I really wanted to do something. Like, I'm just like, I can't. But then if I waited and I was patient, it paid off. But it really is something that you need to like be very clear about,
Good
especially when you're
point.
working towards a goal. You don't want to look worse, but you're gonna.
Yes, that's good. That's a good point. Definitely can happen. That's for sure.
All right,
Okay.
so complications.
Yes. Let's talk about
What
managing
tell us
complications.
what kind of complications can arise?
Well, in the darker Fitzpatrick, I can imagine, like you said, you touched on the coloring of the skin. Hopefully, it's not going to be too much of texture, but there would be some of that. But letting your clients know what is okay, what they might think is the complication is part of the effects.
Mhm.
So, what don't we want to happen to the skin? So that, pigmentation changes, that's an
Mhm.
issue. That's that post-inflammatory response that the skin with all Fitzpatricks can happen, but definitely with the darker Fitzpatricks, right?
Yeah, and I think if you're doing peels where your client is peeling or anything like that, not to pick at them because picking can cause more of that hyperpigmentation or changes in pigmentation,
If the skin is peeling, don't pull it. Make sure they understand that. Allow it just to slough off on its own.
which sucks. It's
It
part of the
does.
thing that really sucks. Like, I've had conversations with people of, like, their skin hanging off their face because they're peeling, and you're just like, "I know that you're not supposed, I wanna reach over and pull it for them, but you cannot pull the skin."
But it almost sounds like it's a permanent makeup thing. The same thing with that, right? It goes to the ugly stage before it looks nicer.
It really does, and, like, with permanent makeup where you got your scabbing, you're not supposed to pick on, like, this is just part of, like, you have to let the skin heal itself, and it will.
Yes. I love that point. Let it heal itself. Yeah. And then, of course, the post peel kits for them. And then after treatment, if they're finished their sessions, what can they expect? I guess you could say
Mhm.
after it's all done. What are your thoughts on that, Jereen?
Well, and I think that is a conversation that you have along the way, right? Like, as you're going through your treatment protocol, are you where you thought you would be with your client? Are you running into any kind of blocks in progress with their skin? Maybe there's something they're not telling you. So I think where you are at the end of your series depends really on how it went all along.
Mhm.
I never make promises of, like, "Oh, we're gonna do a series of 6 and you're just gonna get to your goals." We're gonna do to help you work towards your goal, but I never make promises because it just depends. Everybody's skin has a mind
Right.
of its own. It reacts differently, right? So I think it's just getting to the end and then would you do, like, a post consultation, like, go through how are you feeling about where you,
I think that would be
what it remains as your goal, and then how do we address that moving forward?
that could be another session without the treatment. It's part of
Mhm.
it, just like you did your consultation, right? Your
Yeah,
post
like, I think at the
treatment.
end, like, your last treatment, they come back in 2 weeks, and
Yeah.
that's your wrap up, right? Then you sit down, you're like, "Hey, how are we feeling? What are you still, working towards?" Stuff like that. What worked for you? What didn't?
So really all overall when we're working with darker complexions is, careful selection of products, what you're going to
Mhm.
use, that meticulous application, like the plan behind it, right? What's the goals of the client? How are we going to do this? A range of treatments through a certain time frame of weeks or months type of idea, and educating your client as much as you possibly can. Give them all of that they need, right? So that they can make those right choices when they're not with you as
And I
well.
think absolutely, and I think, like, the darker Fitzpatricks, you have to just let them know that it's not an intense peel. Like, I always keep it very light. I go light peel and we work slowly towards your goal, because causing any complications or damage to the skin is really working against the goal that your client came in to see you, and
Yeah.
setting the expectation for, this is your skin tone and these are the limitations because of the possible complications. And I
Yeah.
think I think a lot of people do know that, but I know I've seen a lot of different social media folks, different Fitzpatricks peeling the bejesus out of their skin, and I'm just like, oh, that's scary.
And on another note, just to mention, we'll speak of, well, I mean, in the States, it's the same thing. Every state's going to have their guidelines and their restrictions in Canada as well. So that it is your due diligence to know what you're allowed to use in the scope of practice of your certification. Just because you can get your hands on it,
Yeah.
people like Amazon, these websites, doesn't mean you should be using it on your clients. So please make sure that you don't get in trouble with
Mhm.
your government regulator. I don't know how to explain
Yeah.
that, but I think people know what I'm talking about. I know people have said, well, I can get my hands on, I won't say the name, and I say, okay, but that's banned in Canada. In our scope of practice, we're not to be using that. Yeah, but I can get it. So it doesn't mean because you can get it that you should be using it. You can't use it. And I think we need to remind ourselves, well, first off, why are you thinking you're better and beyond what they're regulating? There must be a reason behind it. And you can't compare yourself to a doctor level training to compare to, even if you've taken advanced training. If you are a medical practitioner, and that's again the nurses, the doctors, that level, they are able to take higher level courses. In our scope of practice, they can call it advanced, you know, chemical peel course, but it's not medical level.
Mm-mm.
So just keep that
Exactly.
in mind. Like it's good to understand all the peels, and it's
Mhm.
really good to know what's out there. What are the medical places using? So you have a good understanding to why they're doing what they're doing. But if you explain to your clients, well, in my scope of practice, this is what I'm going to do for you. This is my training based on the products that I carry and
Mhm.
why I choose to do it this way as well. And I think it's important just to explain that as well. Don't try to compete with the doctors or the medical practitioners,
Absolutely.
and I think that's a big part. And if you don't know, ask your insurance company,
Oh, yeah, that's a good one.
right? If you're not sure, because you can Google like we did. It's like, is it or isn't it banned? Where do we find this? So we went right to the Canada hot list, right? And that's where we discovered some of them too, that people are still they call in, hey, do you carry this? It's like, no.
Mhm.
And nor should anyone else in our area
Yeah.
of practice. Yeah.
I think another important point, and that's a thing that I always go by, is try it on yourself. I think that in order to really help your clients understand a certain experience, yes, it's going to be different depending on different skin tones and different how your skin reacts. You need to experience it for yourself. Giving chemical peels and not having received one, it just it would be odd. I think do it
Yeah,
on
but
yourself
I think
if you're
that's
having it.
totally fair. Some people have told me when they've taken courses of all levels, they've they're waxing people and they've never had waxing done. It's like, and in your course, you didn't get waxing done? My God, I remember when I first started to do, okay, first day of class was let your hair grow
Mhm.
because we're going to be waxing soon. It's just
Yeah.
part of you have to experience to understand it. And I think that's a really fair point. And if you don't qualify for the peel that you're using, well, what do you qualify based on your skin
Yeah.
type? And what can you do, or what area could you try it on that's safe? It doesn't always just have to be on the face either, right? So
Yeah, that's
there's
true.
places you can do it. So, well, hopefully
Absolutely.
this has helped, performing chemical peels and keeping it safe with our darker skin tones.
Exactly. Just go slow. And as always, if anyone has any comments or questions, just let us know. Thanks for listening to Beauty Babble.